Hello, good afternoon. Good afternoon at last, and thank you very much for joining us. A big welcome to this, our National AIDS Trust webinar today. My name's Jane Anderson, and I have the huge privilege of being the chair of the Board of Trustees of the National AIDS Trust. And today's event is a very special one, because not only will we be discussing some of the most significant challenges that relate to HIV in today's world, with a panel of amazingly distinguished guests, we're also releasing our new strategic plan for the next 5 years. And in both, we look at HIV through the lens of human rights and intersectionality. Fighting for and defending human rights is by no means a new approach for the National AIDS Trust. Our new 5-year strategic plan reaffirms and centres human rights at the heart of everything we do, which is why we have chosen this topic today with a panel of experts to set out and really emphasise the importance of these issues if we are to continue to tackle HIV effectively. HIV, although of course a medical condition, has always been so much more than a medical issue. The causes and the impact of HIV in the UK and globally is inextricably linked with inequalities that are entrenched and compounded by prejudice and injustices, particularly around race, gender and sexuality, and for which empowered community-led action in the defence of rights for all individuals has been absolutely critical. National AIDS Trust's view of the world is a vision where HIV does not stand in the way of health, dignity or equality for anybody. We believe we can't reach this until all people have their human rights realised. And our new strapline, Stopping HIV, reflects that. Securing rights, stopping HIV, reflects this. 18 months ago, we embarked on a strategic review. And this incorporated a listening exercise with community members and other key stakeholders. We're incredibly grateful to everyone who gave us their time and expertise to make sure that we got this right. And we took a close look at ourselves to make sure we were doing the right thing in the right way. And what we found was that our work and unique role as an organisation which focuses on HIV policy in the UK was needed now more than ever. The launch of this strategic plan also comes with the backdrop of the COVID-19 pandemic, which has shone an even brighter light on the interrelationships of health, inequality, and socio-economic impact. And we can see now, more than ever before, how critical it is that we protect the health of all and the consequences if we don't. We can see the consequences in front of us today of deeply entrenched inequalities on health outcomes. In COVID-19, as in HIV, it's no coincidence that those who experience structural discrimination and marginalisation within society are those who've been affected the most. We must learn from this and use it as an opportunity to champion the rights and voices of those people and redouble our efforts to prevent the further entrenchment of the inequalities that led to this situation. I'm a doctor and I've worked in the field of HIV for 35 years, and we have seen enormous progress. Yet every HIV clinician knows that effective medication and viral load suppression, although absolutely essential, is only part of the picture for people living with HIV. To ensure that HIV no longer stands in the way of health, dignity and equality, we also have to look beyond the impact of the virus itself to the many other overlapping issues that are disproportionately affecting people living with HIV and those communities that are the most likely to be affected. Through our continuing expertise, our research, our advocacy, we want to secure lasting change. And we want to do this with the people who are most affected. And this underpins our 4 strategic aims for the next 5 years. Firstly, ambitious, we will stop new HIV infections. We have an incredible opportunity in the UK to bring new HIV infections to an end. However, standing in the way of reaching this goal is an underfunded public health system in which its different parts don't always coordinate as well as they might, a population undereducated about HIV, and disengaged politicians and decision makers. We need action to remove these obstacles. Secondly, we will champion the needs of people whose voices and experiences are too often ignored. Despite the UK's success in HIV prevention and treatment access, progress is not experienced equally by all those affected. People living with, affected by, or at risk of HIV come from diverse communities, including their protected characteristic, location, and experience. Structural inequality means the specific needs and experiences of those groups and individuals are not high enough on the HIV agenda. The impact of this failure is starkly demonstrated in the COVID-19 epidemic. National AIDS Trust will foreground these inequalities and will ensure that we play our part in creating health equity. Thirdly, we will protect the rights of everyone living with and at risk of HIV. Access to healthcare, health equality, social justice, and a life free from stigma and discrimination are basic human rights. We know that the defence and realisation of human rights requires more than having the law in place. It requires the defence and protection of that law. It requires access to recourse when things go wrong. It requires the breaking down of structural beliefs and value systems that undermine that law and sometimes bring it into question. Our work over the next 5 years will ensure that people living with HIV can realise these rights. And fourthly, we will drive engagement and activism to change attitudes to HIV. We can't stop HIV harming people's lives on our own. We need a paradigm shift in public awareness of HIV and support for people living with and affected by HIV. By working together with individuals and institutions, we believe we can drive engagement, influence, and activism and make real change happen. So today, to help us explore some of the ideas underpinning this new direction, I'm absolutely delighted that we're joined by a panel with a wealth of expertise and experience. And now I'm really pleased to hand over to Hugo Greenhalgh, who's going to facilitate the panel and who will introduce the speakers. But firstly, let me just introduce Hugo. Hugo Greenhouse is the LGBT editor of the Thomson Reuters Foundation, which is the charitable arm of Reuters, and he edits its LGBT+ news website known as openlynews.com. Prior to joining the foundation, Hugo spent 11 years at the Financial Times in a variety of roles, most recently as the editor of the FT Wealth magazine and an editor on the comment desk. Over the past 25 years as a journalist, he's launched several magazines, written for most of the UK broadsheets, and reported live from Red Square. Hugo, we couldn't have anybody better to facilitate this panel. Welcome, and let me hand over now to you to introduce the panelists and the next part of the afternoon. Hugo.
Jane, thank you very much for that very warm and very inclusive welcome. We've got a fantastic panel for you today of some great speakers with some huge wealth of knowledge between them. Before we get started, I'm going to quickly introduce you to the panelists, but a couple of quick technical things for people who are watching this webinar. First of all, there's going to be a Q&A session after the end of the panel discussion. So if you'd like to ask a question, you can do that through the Q&A function on Zoom. So it's next to the chat one. Don't use the chat function, use the Q&A one, and then we'll collect your questions as we go on. But if you want to ask a question in the meantime, whilst we're speaking, raise your hand. There's a raise your hand button. We'll see that and we'll pick up your question and hopefully include you in the panel session as well. Your camera will not be shown on screen, but if you do have a Zoom profile picture, this will be shown alongside your name. And if you rather ask a question anonymously, that's also fine. You can do this through the Q&A function. We also request that no questions asked through the chat function, as this will not be monitored. One final thing, which is attendees' live camera won't be shown at any point during this webinar, only their voice will be heard. So those are the technical things. Thank you again for joining us. Just quickly now to introduce you to this fantastic collection of speakers we have here today. I'm going to introduce them in order of precedence. I have warned them as well, I'm going to be quite strict in terms of timing. We've got quite a lot to get through this afternoon, so they have about 5 to 6 minutes, which I will be enforcing quite tightly. But first of all, we're starting with Deborah Gold, who is been Chief Executive of the National AIDS Trust since October 2014, after a career in the voluntary sector, including 6 years as Chief Executive of LGBT anti-violence charity and roles at Shelter and Stonewall Housing. Dennis Iyango is the Programs Director at Africa Advocacy Foundation and a member of the One Voice Network team in charge of partnerships. He oversees AEF sexual and reproductive health work in UK and Europe. Dennis has over 19 years experience of grassroots community health promotion work. Juno Roche, I'm sure you'll be aware of, is a writer and thinker. Her books include Queer Sex, Trans Power, and Gender Explorers. She's currently working on a new book that investigates the place at which class, HIV, and trans meet, intersect, and produce layers of societal judgments. And then we're on to Nancy Kelly, who's just become Chief Executive of LGBT equality charity Stonewall in June 2020, after a 20-year career working across the third sector and government. Most recently, she was Deputy Chief Executive and Director of the Policy Research Centre at the National Centre for Social Research. And then finally, but certainly not least, we have Sanchita Hasali. Sanchita is a recognized expert in human rights and equality law, policy and practice, with almost 20 years experience of working both in the UK and internationally. At the British Institute of Human Rights, she's overseen large-scale projects to implement a human rights approach in health and care, working with service providers, advocates, and people using services, as well as the regulator. So that's our fantastic panel lineup. And without any further ado, Deborah, if I can start with you, thank you.
Hi everyone, this is a very strange thing doing this via webinar, but thank you so much for coming along and for such a huge mix of people. And I'm going to try really hard to stick to my 5 or 6 minutes because I'm terrified Hugo's going to cut me off. But I just wanted to start by framing a little bit why this issue is so important to NAT and a bit about kind of what we think about it. National AIDS Trust, we're an organisation, as Jane has really described eloquently, working to protect and defend human rights for everyone at risk of or living with HIV. And we believe, alongside the World Health Organization, that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. But we also know that still in the UK, in HIV, the ability to realise those rights is hindered by a whole range of issues, and they include race, immigration status, gender, sexual identity, economic and social conditions. And it's hindered by complex HIV stigmas that are interwoven with other stigmas: racism, homophobia, transphobia, and sexism. We're at a really important and exciting moment in the 40-year fight against HIV. People living with HIV who are diagnosed and treated in good time will enjoy good health and live a life of as many years as anyone. And once on successful treatment, they can't pass HIV on. Combination prevention is as good as it's ever been, with a reducing pool of people able to transmit HIV, growing access of HIV testing, condom use and PrEP, and the ability to functionally end HIV transmissions is within our grasp. But exciting as that sounds, we also know that progress is not equal. In 2018, 3 in 5 people diagnosed with HIV in England were born abroad, and yet most of them acquired HIV here in the UK. We're not doing enough to understand the needs of different migrant groups in the UK and reach them with the right prevention messages. And whilst an average 43% of people are diagnosed late with HIV, this rises to an astounding 65% of Black African men. We're not doing enough to reach the members of the Black African community in the UK with messages around testing and the benefits of HIV treatment. Almost half of women living with HIV in the UK live below the poverty line, and over half have experienced violence because of their HIV status. And we're not doing enough to understand what a gendered approach to HIV would look like and to ensure that women living with HIV are safe and able to meet their most basic needs. When PrEP first hit the mainstream news, headlines compared gay men with HIV to the blameless sick and described PrEP as a promiscuity pill. And we're not doing enough to combat the pervasive, insidious homophobia that still affects public attitudes to HIV. When trans people access health services, they're often met with confusion and judgment about their bodies and needs. And we're not doing enough to ensure that services can meet the needs of trans people and provide a safe and welcoming environment. And today, when hours before this event, the government announced that after 3 years and thousands of responses in favour of change, it will do nothing to improve the lives and rights of trans people who have lived with growing, intolerable levels of transphobia in the last few years, we are especially not doing enough. And I've just listed some of those inequalities that hinder the fight against HIV, and I've done it by neatly dividing people up into groups: gay men, migrants, trans people, women. But life isn't like that. Some women are also trans, some Black African men are also gay, some trans women are also migrants. And my point is that to really understand some of the driving forces behind the epidemic, we need to understand intersectionality. And we have to make space for understanding the complexity of people's real lives and the way in which people's individual experiences affect how they do or don't learn about HIV, how they feel about themselves, their access to social capital, whether and how they test for HIV, and how and whether they access treatment. And we need to foreground their voices and the lives and needs of people with different experiences to make sure that we design campaigns and services that meet those specific needs. That means protecting free access to HIV treatment for everyone, regardless of where they're from. It means ensuring people living in places of detention can find out if they have HIV and access treatment if they need, for example. It means fighting the poverty that disproportionately affects so many people living with HIV. It means when we say we want access to PrEP for everyone, it's not good enough if we don't do anything to ensure that the people who don't know about it find out and access it. It means that when we say we want better long-term condition management for people living with HIV, that's medical jargon for saying we want to ensure that people living with HIV can access their full human rights by getting the healthcare they need for their whole person. And really all the work we do at the National AIDS Trust can be encapsulated by that overall aim, to ensure that the right health is available to everyone. And that's why we've placed that at the centre of our strategy for the next 5 years. And I'll stop there and hand over to other panel members, because I'm sure you're ready to hear from some non-National AIDS Trust people to get this discussion going.
Deborah, that was beautifully done, and also 5 minutes and 7 seconds as well. So the spot
what can I say?
But there's a huge amount of stuff that we will definitely come back to, particularly in terms of your central point about the need to understand intersectionality. I think that that's a key point. And just to add one thing before we move on to Dennis, I mean, certainly that the lack of understanding of the issue is still absolutely critical. When I take PrEP, when I go to the doctors, my local doctor, and talk about being on PrEP, they presume it's because I'm HIV positive. They haven't got a clue. Yeah. You know, that level of understanding needs to go right down to the fundament, basically. But anyway, but Dennis, let's come on to you in that case. If I can just pass the microphone, as it were, over to you.
Yep, thank you for this wonderful event. I am representing OVN, One Voice Network, which is a collective of organizations that are working with Black communities in HIV. And I'm trying to fill the big shoes of the chair, who is Derek. Just to go back to sort of my presentation today, is really around migration and race in regards to HIV. And, you know, we all know that migrants really, in Europe especially, in the UK and Europe, especially those ones who are in precarious situations, they always face a lot of disadvantages and difficulties. And we also know that, you know, the political climate, there's xenophobia, you know, the legitimization of exclusion of migrants and mistreatment of people, the hardening of borders, and, you know, stuff around how migrants are generally viewed as always exacerbated, you know, the situation of HIV. We know that over 50% of migrants who come to Europe get infected in Europe, and that goes to 75% for men who have sex with men. And so issues around right to access, you know, the hostile environment, you know, what migrants think about, you know, how they are valued as individuals, stuff to do with the racism that they see every day, stigma, quality of life, and poverty all have an effect on how people relate to services. And so, you know, we also know that in terms of service provision, we are always seen as one group. So of recent, people have been talking about the term BME or BAME, and whether that actually describes, because, you know, we are quite diverse in terms of gender, in terms of sexuality, race, cultural heritage, religion, health status, you know, the health conditions, the socioeconomic factors. And also, you know, when service providers or when services are planned, you know, they always plan them in such a way that it does not recognize people's unique, you know, diversities. So I think that's something that needs to be looked at. But also when we look at intersectionalities, we don't always try to look at how other aspects of health, you know, sort of impact people's, other conditions impact people's health. So we know that people living with HIV have a lot of issues, especially those from minority backgrounds, have a lot of issues around quality of life as they age with HIV. We also know that a lot of people are experiencing mental health situations that are not adequately addressed. We know that a lot of people who are living with comorbidities have not been assessed, you know, as they are supposed to be. And this, despite the fact that the healthcare professionals are doing amazing jobs and, you know, commissioners are trying to commission services, but these issues are still not being addressed. And so when we talk about, we need an intersectional approach, obviously, to these issues and a human-based approach to them. We need to ask ourselves whether people are actually participating in decisions that matter to them or that touch on their lives. We need to talk about accountability and whether issues around are being monitored effectively, whether decisions that affect people's, when there's a breach, whether these are being addressed adequately. We need to talk about accountability, non-discrimination. We need to talk about equality and the legality around this. And so how do we do this? I think we have to start with, you know, the organizations that hold the power and the influential positions to share that power and recognize that the legacies that have led to inequalities are partly responsible for the kind of, you know, poor outcomes we're seeing among migrants at the moment. And, you know, as communities, as a community, Black community, you know, we've been talking about, you know, COVID highlighting the structural barriers. And I think that, you know, this is not the start. We've seen the Grenfell Tower, we've seen a lot of the Windrush generation. All these issues are interlinked and interconnected. And I think that we need to acknowledge that there have been failures. We know that from the action we've seen what government has done around COVID, we know that if there is need to do something, changes will be made. But at the moment, it seems that no one is interested in addressing some of these issues, or at least not people who make decisions are not interested that much. And I think that we are not going to reach zero by the stated timeline if we do not actually address some of the structural, you know, barriers that people experience, some of the racism and exclusion that we see. And so we need to an action on health, but also we need to address poverty. We need to look at how people are being treated, you know, policing. We need to look at the way migrants are drowning and dying in the Mediterranean. We need to address all these issues on our conscience, and that cannot happen when we look at issues in isolation. So that's my presentation. I welcome any questions.
Dennis, again, thank you very much for that. Again, I think kind of bringing back to the kind of central point about intersectionality, but also talking to your point directly about the structural inequalities. I think that's an absolutely crucial point that we'll come back to later. And if I can just encourage people again to please put your questions in the Q&A box on the side of the screen. You'll see this little Q&A kind of thing at the bottom of the Zoom screen, and we'll come to them at the end of the panel session. But if I can move on in that case and come to Juno, if I can, as it were, pass the metaphorical microphone to you, thanks.
Oh, I think, am I unmuted? Yes, I'm unmuted. So hello everyone, it's lovely to be here, but normally I don't write anything, and then I talk and I talk and I talk and I talk and I don't stop talking, I go right over. So I've actually written something, so excuse me for looking downwards. That feels very rude of me. I really wanted to get to the points I wanted to get to. So Simone Weil, one of the foremost thinkers and philosophers of the 20th century, said of equality, and I paraphrase, that unless you address the thinnest edge of the wedge, which may be one person, or the trace of a single person, or even the memory of a single person destroyed by societal inequality, then you do nothing for equality. It kind of reminds me of the GLC and the Sun's headlines in the kind of late 70s, early 80s, when they would put the kind of headlines, the banner headlines of one-armed black lesbian gets funding to do a poetry workshop. And actually, and I suppose what Simone Weil would say is that actually, that unless she gets equality, none of us get equality. So in a sense, trans people in society, especially trans people of colour, and especially trans women of colour living with HIV, are often reductively and collectively treated as a singular person at the thinnest edge of the wedge. Although I know from my years of work that our numbers are always higher than one, but that we are often so marginalised and removed and obstructed from the structures that provide security and safety that we can seem as one person, one reductive type to ignore. As Judith Butler says, some lives we can just allow to be disposable. Some lives we just don't think are going to be missed. Think COVID and black and brown frontline staff. Think gay men at the start of the AIDS pandemic. HIV has always been tied up around a narrative of disposable lives. I suppose that structural marginalisation is where the vastly inaccurate term hard to reach emanates from. How many times I've heard hard to reach over this last 20 years. You know, I'd be rich. That kind of silly old saying, I'd be rich if I had £1 for every time somebody had said that someone's hard to reach. I was going to swear here, I'm not going to swear here because I've read the room. But we're not hard to reach. It's just that we have all failed to address the structures that implement inequality. When we talk about intersectionality, I should clarify, when we as white people talk about intersectionality, I should clarify, when white people in positions of power or leadership talk about intersectionality, they usually get it wrong on every level. Intersectionality isn't about a character trait or a life trait or a personal preference. It isn't about being HIV and, say, being a Catholic. It isn't about being me, a white trans person, middle-aged person, an ex-sex worker, an ex-drug user who's lived with HIV for many years. No, those things are data, places where choices meet or lack of choices meet. When I leave my house, the world sees only a middle-aged white woman. My HIV is not evident, nor is my gender identity. I can glide through this world under the cover of white supremacy if I chose. I can glide through this world under the cover of white control of capitalism and all of its structures, which include healthcare. That's not to say that the facts of my life make it easy. They don't. But when I leave the house as a white person. And I think we need to center that in our discussions, especially at the moment in light of COVID and the number of unequal deaths of people, of black and brown people. It's important to recognize that the basis of intersectionality has a legal footing in economic parity and equality. It's not just about people sitting around a table. The word's usage stems from a black woman being paid less than a white woman for the same low-paid job. It's about money. It's often about, it's about economics. A black white trans woman in the UK, in America, across the world, I know from my own research, is likely to be treated badly by every civil structure in the land. Healthcare, the police, education, etc., etc. If I am here to talk about trans lives, I centre not mine or the GRA today, but I centre those lives of black trans women, especially those who live with HIV, who principally made up the 49 times more likely to be HIV than any other group. That quote that was so often misquoted by white people at conferences. You know, it was that we have to honour that number. That number was black and brown lives. I know I went through it with a fine-tooth comb. I feel like I'm running out of time, so let me get on. I'd ask you today to look around your teams, your offices, your frameworks. How many contain a single black trans woman living with HIV? How many? Sure, people might have roped in one or two as community advisors. People have done that with me for years, seeking out my history for the price of a sandwich so that they can tick a box. But if you truly want to engage with intersectionality, and equality, and both honour and protect trans women living with HIV, you have to think about how you can step aside and allow them to lead, or lead them to lead, or employ them to be future leaders. We're terrible at doing that in the UK. We still employ a system, almost a class system, wherein the most marginalised serve to inform but still remain at risk. You know, whilst others, principally white men, remain in the kind of very centre of comfort.
And June, if you give me 1 minute, please, thank you.
Thank you, I'm almost done. If you want to engage, you need to look around your offices. Truly, we're not hard to reach. If we were sat on the table next to you, then you could just turn around and talk to us. If we were in your offices, you wouldn't be looking to find us in the community. You know, it's about that. It's, you know, it's more than intersectionality. Is a word that we as white people have to honour. It's not a word that we own. Thank you, I'm done.
I think that's a great phrase that will resonate, a word that we need to recognise and to own, but also I think you're talking about how to ensure that those voices that aren't heard can be heard as well. And I think it's a really important point that we need to come back to as we move on. And we are going to move on now to Nancy Kelly, who's going to talk to us a little bit about her experience and also presumably about the work of Stonewall as well. So Nancy, over to you, thank you.
So I have the great misfortune to speak after Juno, who has already said every possible eloquent thing on the topic of intersectionality. So thanks for that, Juno, leaving me with nothing useful to say. I really want to kind of basically pick up a bit where both Dennis and Juno have pointed around thinking about, I guess, solidaristic intersectional movement building, and thinking about it from the perspective of a white-led LGBT organisation. So hopefully it will resonate. There'll be maybe a bit of repetition, and I won't be as eloquent as any of the previous speakers. So I think when I approached coming today, I thought about the fact that as a LGBT, as a queer human rights organisation, something really important about where our own thinking starts and where it's ending. So if our frame of reference is LGBT rights, who is it that we're seeing in our mind's eye? Which journey do we see? And so I've tried to kind of come here thinking through the lens of a migrant experience, and particularly men who have sex with men and migrate into the UK, that is one of the groups that kind of others have picked up. What do we know about that group? Well, as you've heard from Dennis, and from Debbie actually, they're at high risk of acquiring HIV. We know that the majority acquire HIV after migration. And I think that in public narratives, maybe in specialist narratives, everyone knows that, but in public narratives, this is seen as you're coming from another country and you come already with HIV. I think it's really important, particularly for LGBT communities, to own that actually these folk are acquiring HIV here and with us, right? There's something really interesting to me about the fact that there isn't a kind of simplistic narrative here, so that it's actually one of the few areas where refugee men are not more vulnerable. So it's kind of migrant men and refugee men slightly less vulnerable, probably because of economics, right? No money to go out. But we know that yet youth and the length of time in this country or in another higher income country makes a big difference. So when I kind of think about that in my head, and the fact that these are groups presenting late to services, they experience worse health outcomes, and there are all of these assumptions that we've got about what drives that in terms of stigma or increased risk behaviours, etc., all the things you know much better than I guess the thing that makes me think about as the chief exec of Stonewall and an organisation kind of grappling with our own kind of questions around meaningful intersectionality. As an aside, we've got roles open at the minute and are prioritising trans and people of colour candidates. So anyone on the call that wants to talk to me about those roles, please come to us. We would like more trans, black and people of colour to be in our offices. So great shout out there, Juno. I think the first thing that perhaps some of you need to ask ourselves is, what does it look like to sit at that crossroads of racism, of xenophobia, homophobia, biphobia, transphobia? And what about that experience really determines and drives the pathways that people experience? So kind of elevated risk in country of origin, elevated risk here, barriers to disclosure, help seeking, etc., etc. And I think a lot about the fact that for those migrant men. They're migrating away from countries that may be more homophobic than the UK is perceived as being. But they're migrating to a place where our community's got a really serious problem with racism and xenophobia, largely, I think, still just unaddressed. So the idea of breaking down stigma within a migrant community, that's not going to make them any safer or better supported within the LGBT community. So I think there's a really there's a bit of a kind of racist set of assumptions that we often bring to kind of what the problems are here. So if I think about my baby thought experiment, it brings me to this place of what meaningful intersectionality looks like within our movement for LGBT liberation. And I guess firstly, my thought is that liberation movements are constructed, and more particularly reconstructed, as being single access struggles. So the great example of this is, of course, the erasure of trans people of colour and people of colour from LGBT rights movement globally, which kind of continues to this day, right? And whenever we're speaking, like I'm speaking now as a white cis person, there's a risk that we fall into that sort of single axis thinking or hierarchical thinking. So I guess in HIV terms, first we need adequate healthcare, then we need to address how, say, an LGBT migrant accesses it. It's exactly Juno's point about, you know, the sharpest point, right? If you go, well, let's sort out the big issue where that's access to healthcare, and then we can sort out the little issue. But liberation struggles are interlinked, not least of us, because so many of us hold multiple identities. So for me, kind of what is effective collaboration? What is movement building when it engages migrant and racial justice movements, women's movements, reproductive rights movements, LGBT movements as full partners in HIV advocacy? And how does the HIV movement expand its own horizons so it's addressing that larger set of social and health issues? I think critically for me, the question I asked, which was not the question I asked myself, which is not what I was asked to answer, is kind of how does it help to locate the experience of an HIV positive migrant within the narrative of LGBT rights or within the narrative of homophobia and transphobia? Where does it help? Where does it harm? And how do we challenge racism and xenophobia within the LGBT community and within our movement, and support LGBT migrants to carve out a stronger place within migrant movements also? For me, the goal is to build an interconnected intersectional movement that understands the relationship between diverse identities and oppressive systems, that addresses the interconnected roots of those oppressions, and that centres the voices and experiences of the most marginalised, and work with a radical sense of hope that change must come. That's me.
Nancy, thank you very much for that. I think that you've asked a series of very important questions, and also you've actually kind of created some of the answers there as well. But I think the key one for me was, what is it like to sit at the crossroads of biphobia, transphobia, and xenophobia? I think it's a critical one that we'll come back to. I can see some questions are coming into the Q&A bit along the side, so please do keep them coming. We've got 2 in so far. Please, it'd be great to get a couple more. I see one's waiting to be answered already. But just going to go on to our final speaker now before we come to the open Q&A session. Sanchita, over to you. Thank you.
Great, thank you. Hopefully I'm off mute. That's always the danger of Zoom, isn't it? Brilliant. Well, never mind kind of Nancy's speaking plot. Now I have the unenviable task of going last. Now I have to somehow outdo all of those people, which of course I'm not going to do. But it does feel right to kind of maybe actually at the end of everyone else's kind of interventions for kind of what I'm going to focus on to be maybe the kind of final part. So I'm going to talk a little bit about a human rights approach and kind of what that means and the value and the power of that. Because as we've already heard, that's kind of so interwoven into National Wage Trust's new strategic approach. But kind of what does that actually mean? And my organisation, the British Institute of Human Rights, we fundamentally believe that a human rights framework is something that can help us address the challenges and barriers that we face on a day-to-day basis, but that it also has a really important preventative function, which I think is something that we very rarely do and we very rarely look at, particularly in the UK. I think when we talk about human rights, we often think about them as an afterthought. We think about them as accountability once something has gone wrong. We look at the treatment, the experience, the challenge, the discrimination that a person or a group of people face. And we know instinctively that it's wrong, and we can say, yes, kind of actually that link to human rights is much easier to make. That is an abuse, a human rights violation, a breach. And it's a really powerful language of accountability. And it's powerful because it's not rooted in individual moral compasses, but it's rooted in international standards, which are supposed to be about that code of the relationship between individuals and those with public power. So the idea that we have some kind of rule book for how people are treated. And I think it's important for us to kind of, when we're thinking about human rights, to remember that actually that power is not just big government. It's not just number 10 Downing Street and the ministers in the departments that we might be lobbying, but it's also all of those everyday manifestations that we bump into. It's the person in the health service that we are interacting with. It's the housing officer, it's the teacher, it's the immigration official. It's all of those people as well. And actually human rights is, when it's kind of implemented properly, it should be about the language of accountability between people and those officials. And calling out abuses is really important. But the preventative function, I think, is maybe something that we don't necessarily do particularly well in the UK, which is the perspective I'm coming from, and thinking about how we can use a human rights approach to not just address those breaches, but also prevent them from happening, to change those structures, to change the conversation, to redress some of that power imbalance. And in the UK, we have the Human Rights Act, which often much vilified in the press and in our politics, but I think that's often the sign of good human rights law, because the point of human rights law is to constrain the power of the powerful, and if the powerful don't like it, it's probably doing quite a good job. But it is actually a very powerful tool as a law. It has really powerful duties around ensuring that those public officials, both big and everyday kind of public officials, that they are respecting our rights, that they're not breaching them, that they're not restricting them unnecessarily, but also positive obligations to step in and protect, to do things differently, to think about what they're doing in a different way, and actually kind of to frame that within this understanding of human rights, and also to fulfill them, to think about actually what has gone wrong and what do we need to change to make sure that that doesn't happen again. And I mean, it's astonishing that I often at BHR, I will kind of do our work directly with leaders, so directors of social services or national public bodies who couldn't possibly tell me that that is in fact what the duty under human rights law in the UK requires them to do. It is often big news to those working both on the front line and in leadership positions. But yet human rights has so much to offer in terms of addressing HIV. If we look at the issue of the right to life, I think instinctively you can think about treatment options and kind of where that comes in, but also what about things like hate crime and violence? Why aren't we talking about accountability around the right to life in those issues? We can talk about freedom from inhumane and degrading treatment. And what's really powerful about the kind of human rights conception of that is that this is not about intentional harm. So it can be intentional harm, but it can be unintentional harm. And when we're thinking about intersectionality and actually the impact of different policies, laws, practices and decisions, it isn't about whether it was intended to cause harm to a person or a group of people, but it's about the impact. And that again gives us a powerful lever to go back and challenge what has happened. And again, that could be violence and abuse, but thinking more broadly, we can also think about that in terms of poverty, destitution, some of the really important intersectional issues that we need to be looking at in this kind of particular context. I could go on and on sort of listing the different rights that are really relevant kind of to the conversation that we're having today. And of course, the right to non-discrimination is really important, particularly within a human rights context, because what it does, which is quite different to equality law, is it doesn't work on a protected characteristics basis. It's much more about the person, and kind of actually when you're thinking about intersectionality, when you're thinking about discrimination being compounded by a person's different identities, it's about not just I experience discrimination because I'm a Black woman, but I experience discrimination because I'm a Black woman who is living with HIV, who is young. It's all of those kind of intersections that are about the discrimination, and I think that can be really powerful when we're kind of talking about why this needs to be addressed. So
one minute, please. Thank you.
Okay, so when I talk about a human rights approach, what do I mean? we use the panel approach, and Dennis actually already talked about this. So we talk about participation, people being involved in decisions that affect their lives. So where are the voices of people with lived experience of HIV across all of the many different intersections that we've already been talking about? Where are they nationally and where are they locally in calling for that change? Accountability, how are we monitoring what the risks and people's experiences are to their rights? Kind of what do we know is happening when things go wrong and what are the remedies? Again, how is that happening nationally and locally? Non-discrimination, this conception of an intersectional understanding of non-discrimination, of seeing that person in front of us. Empowerment, understanding people's rights, but people understanding their rights themselves. And this is so fundamental because I think we often think instinctively that we understand what our human rights are. One of the things we do in our kind of sessions and our support with people is to ask them if they could just, if they do feel confident around their rights, could they just name what rights they have? And actually we have 16 basic human rights in the Human Rights Act in the UK, and we have never had a person be able to call them all out. That tells us something really fundamental. And the law kind of
I'm very conscious of the time, I'm afraid. So just quickly, if you just sum it up in 30 seconds, if you wouldn't mind, thank you.
In 30 seconds, yeah. So I think that essentially kind of the value of a human rights approach is about that power shift. It's about saying, actually, this isn't about something that we have because we're asking for it, because it's charity, because it's a nice thing to do. It's actually about this is what it means to be a human, to have dignity and to have that respected for me and my group, but also for us as a kind of a wider society and community. And I think that value of shift is so important, because to say something isn't fair is not nearly as powerful to say you are potentially breaching the law.
And I found that absolutely fascinating. Forgive me for cutting you off slightly there, but it's interesting. There's a huge history of that as well. If you look at the work of Cherie Blair at Matrix and perhaps the Noughties, if you look at the work of Jonathan Cooper at Daddy Street Chambers nowadays, the human rights approach to any issue, not just necessarily HIV in this instance, but others, has been very, very effective. So definitely want to come back to that. But let's go to the floor in terms of the questions that have been coming in. So thank you very much for sending them so far. I'm just going to go through them and try and merge them together, just again, conscious of time. We've got about 20 minutes or so. And start off with the first one, which it links into the second as well, but it's how do we convince white sector leaders in HIV organizations to take people of color's experience of inequality seriously? When it's white privileged people in power, they don't listen to those of us beneath them as such. And there's a second question, that was an anonymous question, but the second question from Jose Maya, who is also asking, what concrete actions can we take to decolonize health systems? What concrete actions can we take to ensure that participation and engagement within the HIV field is not tokenistic? Dennis, you had your hand up first of all to kick us off to answer that first question. Do you want to come in at this point? Thanks.
Yeah, so thank you for, that's a great question. I think that primarily it's about engagement. So what we have seen over the past few years is that there has not been much leadership in terms of working with Black communities. And this is really, we talked earlier on about structural issues. What most people forget that, and as a migrant coming into the UK, in most cases, regardless of what kind of visa you are on, your life stops for about 5 to 10 years. You are limited opportunities. You cannot, for example, get jobs that you'd want to get because maybe you're in a certain visa category. You are maybe on a spousal visa, and you can. So, when we talk about lack of engagement, and sometimes people talk about Black people not engaging effectively, there are so many other issues at play that make people actually not engage well. And I think that, I think it's a recognition of some of these challenges that's very important. That's a starting point. And I think that, the example within the HIV field, I think that we have like key organizations like NAT and THT that have actually taken lead in terms of just the HIV Commission, but also in how they work with us. So as OVN, we have started that engagement, and we feel that what we should have done maybe 10, 15 years ago is kind of actually happening right now. But most importantly, I don't think it's, everyone in position of leadership should take time to listen, because I've been in many forums, whether in the UK or in Europe, people don't actually get it until you talk about it. And not because they don't want to engage or to listen to it. It's just that maybe they've never had experience of being able to listen to some of those challenges. So I think that's a two-way thing. Leadership on the white side, on people who are leading organizations that make decisions, but also migrants engaging effectively.
Nancy, I was just going to come to you anyway, but you've got your hand up. This very much touches upon what you were talking about yourself, doesn't it?
Yeah, so I'm going to say something very narrow, but hopefully useful, which is that as a white leader, one of the things that I think we can take responsibility is diversifying the leadership of our organisation. Like I think that a lot of organisations, certainly it's true of Stonewall, most of our staff of colour are in more early career roles. And we're trying to take really concerted steps to make sure that our leadership is not dominated by white and cis people. And I think that often gets left off of the list of things you can do. You can fall into talking about, we can fall into, I often have fallen into talking about engagement and kind of listening, whether it's to people outside your organisation or kind of more junior colleagues into it, but getting out of the way, giving people jobs, giving people senior jobs, creating a position where that person of colour is themselves the leader or a leader. Those things are really, really important. I think there's a lot about giving power that white leaders need to do, kind of put down the mic sort of thing, she said, talking into a mic, right?
Juno, I'm going to slightly bump the question slightly over to you, but there's another question that's coming which kind of touches upon that subject very clearly, which is about tokenism. And this is from Rob Hammond, who asks, a fellow trustee wanting to invite a trans man to be a trustee to provide insight and direction in supporting the trans community living with HIV in our area was accused of tokenism. How do you combat that, particularly in the context of what you're saying about making sure those voices which aren't heard can be heard?
Yeah, I mean, I don't know, am I on? Is my camera on? Yeah, okay. I mean, I think it's a kind of bizarre thing where, you know, for 20 years, I've been the only trans person living with HIV that's talked. And actually, this is only, believe it or not, in 20 years, this is only the second time I've ever been asked to talk at an HIV event. And I think it's partially because I do say things like, actually, your framing is wrong. Would you stop framing us as victims? You know, if you're bringing us onto another panel, when you know that 82%, when I last did research into trans employment, about 82% of all trans people lost their jobs. You know, they were marched off the premise. I mean, they literally lost their jobs. So to bring them in as kind of community, on the kind of community engagement is kind of tokenistic. So what I'd say is that if you reframe that and say, well, actually, if you're feeling that it's tokenistic, it probably is because it is tokenistic. I mean, the number of times I'm asked to speak on, not this kind, not around HIV, but other panels, and you know, I know sometimes I actually find they send me the email that says we need to get a trans person, and I say to them on the panel, you've got a trans, you've got me, but sadly we're all white still. You know, it's kind of like I think that we need to reframe stuff. So, for example, around trans people see us as being broken. And they see us, and you know, everybody, you know, the number of people that have contacted me today about the GRA reform, you know, I didn't even think about it. A lot of trans people I know haven't thought about that today because we have other stuff to think about. We're thinking about employment, we're thinking about rates of pay, we're thinking about the number of people that lose their jobs, we're thinking about a whole host of things. But it's like we're framed as being broken and therefore victims. And what I would say is that let's reframe that and say, actually, gender is everyone's problem. So gender, let's talk about gender rather than just isolating and putting out trans people over here and cis people over there. I suppose that's why, in a way, I don't really like the word cis. I get it's important to have it because it's shorthand, but I don't like it because it separates out as if to say there is something different. Whereas I think that actually gender is problematic. If it wasn't problematic, we wouldn't have Trump. I mean, we wouldn't. Trump is an outcome of gender being problematic.
But
and
just to pin you down in that sense, so is there not necessarily is there anything wrong being tokenistic, but at times is it useful because it moves the conversation forwards?
Well, okay, so I'd say that we've been being tokenistic for 20 years, and I think that there is still not a single. I can't name a single trans woman who is in charge, who's a CEO of an organisation in the HIV field. So if you take it that, you know, like 5 years ago, before people had really dug into the overt statistics, people said that trans women were 49 times more likely to be HIV positive than any other group, but less than 0.1% of all funding globally was directed towards working out why. And we have remained tokenistic. So until there are people that are leading organizations, I mean, and I'm in my mid-50s now, that, you know, I write, but, you know, it really saddens me to see that the work we did being tokens. I've stood up on stage at the TUC and I've had men stamping their feet to get me off stage because they said I was less than I think back then it was less than, trans teachers were less than 0.35% of all teachers across the country. So they said I should get off the stage. I've done tokenistic, I think we all have done. But actually what would be really good now is to take some of our stuff, which is about more than just being trans. It's about the problematic nature of gender that comes into sexism and patriarchy and misogyny. All of that stuff is wrapped up in trans bodies. So I would have to say that I think, yes, it's really important that I can be here and can talk, but actually it would be much better if there was a CEO here, a Black trans woman who was heading up an organization, who was really creating structural change. That would be much more important.
Well, let's throw it out to Deborah in that case. And obviously, you're chief executive of an HIV organization. How does it work practically when it comes to these type of issues?
Let me unmute myself. Metaphorically and actually, it's very hard to follow Nancy and Duno on these issues. But in a way, I think that original framing question is the challenge to ourselves and to the sector and the commitment of the strategic plan that we're launching today. I mean, I'm also a cis white woman running an overwhelmingly white organisation that is not representative of the people most affected by HIV, and that is problematic. And one of the things that's really difficult, I think, when you're in the voluntary sector is you think of yourself as being without power, when in fact we have to recognise that we have power, and we have more power than others who don't have a seat at the table. So it's around, you know, I guess for us at NAT, sharing that seat at the table, making space for other people's voices. I mean, there's a load of different practical things we can do, but I think, and making a commitment. I mean, I think when Juno was talking earlier, I absolutely loved, I hadn't heard that quote before, Juno, from Simone Weil, but where you were talking about the single person or even the trace of the person. That, I think that was such a kind of eloquent way of describing really what we're trying to talk about in one of our key strategic aims, and something that has always been so important for how we approach things at the National AIDS Trust, which is saying it's the groups where there's only a tiny number of people who are affected by this that are the most likely to also be ignored and not have their needs met. And so for us, it's about working with those people to meet those needs particularly.
Dennis, if I can come to you at this point and say, okay, we've heard the arguments for, we know the issue is, but in terms of your bigger point, Dennis, about structural inequalities, does this go some way to answer some of that or not, do you think?
I think partly, I feel that we have a lot of still issues to contend with. We know that there's just been a report produced by the HIV Commission that's going to be made live soon, and there are a lot of issues that have been highlighted there. But we know that we continue seeing that the most undiagnosed people, for example, the 5,000 or so undiagnosed people are mostly, you know, migrants. We still know that a lot of people who are migrants or Black communities who are living with HIV are over 50, have one or two comorbidities. You know, we know that poverty has been an issue, especially during this COVID situation. So I think that, you know, there has to be realization, and even commissioners, their hands are tied in terms of how much resources they have to be able to address needs. You know, healthcare services are trying to do what they can. And I think that government needs to take leadership. They need to acknowledge that some of the long-standing, you know, structural inequalities have got a lot to do with how people are faring in health. And I think that we need to start having very honest conversations around how we can correct a lot of the wrongs. And, you know, we see always tick box exercises and knee-jerk reactions on a number of issues. Most of the healthcare, you know, services that are targeted at migrants, just because of that tag of being a migrant or being Black or being from an ethnic minority, has always been tokenistic. And I think that we need to start having serious conversations. And part of that really is being at the table, trying to make sure that we have enough diversity in terms of people who make decisions, being able to have that real representation and not just ticking boxes, and making sure that we develop leadership so that Black people can actually contribute to policy making and development.
Dennis, thank you very much. And I'm going to move the conversation on slightly, and with a question for Sanchita that's just come in, which is quite a practical question. So Sanchita, if you give us quite kind of practical answer to this, but how does the HIV sector make sure it adopts a preventative human rights approach in our practice? So how can you put that, or how can you implement that basically?
Well, I think the National AIDS Trust new strategic plan is a good starting point to place human rights front and centre in kind of as a framing issue, but also interwoven into what you're trying to achieve really practically. So I think that's a really good starting point, because we really do need leadership. So for organisations to actually use that and to take that forward. And I think it also kind of in terms of HIV organisations, I think something that Deborah said is really important, which is that often we're talking then about voluntary sector organisations, right? And we so frequently forget that we become gatekeepers as well, because we're challenging the other gatekeepers that have public power, and we don't have that public power. And therefore we see ourselves as somehow stepped back from that. So there are really practical things that you can do. So that panel approach that I mentioned earlier, there are some really practical things that you can do under each of those sections to think about actually how can we be a more rights-based organisation and drive that agenda forward. And when we work with organisations, we look at that both from an internal perspective, so you as an organisation, how you're working, but also from an external perspective in terms of what you're doing. So actually internally, it's not just about, because it's not just about policy, and I don't think this is an issue with National AIDS Trust, I should kind of preface that, but I think what you can often see is that organisations will talk big policy around human rights, but they won't then reflect that internally and look at their staffing. What is their staffing makeup? What is their staffing knowledge, kind of staffing confidence around human rights? And actually, is this a policy commitment, or is this about how we do our work? So kind of for example, we've just done a big piece of work around COVID, and our response kind of to a call for evidence from Parliament around the human rights implications of COVID for people with care and support needs, because that's a group that we do a lot of work with. And we all could have sat at our desks and written something kind of quite high level and policy focused. We're most of us legal experts, we can talk about human rights. But actually what we did was work directly with people, got them to tell us their experience, what has that meant for you, worked with their community groups, and then worked with the frontline service providers and the staff in those organisations who have actually been implementing that policy. And that's what we developed as our policy approach. So I think there are really practical things that you can do, thinking about how are we working as an organisation? How is the voice of the people that we are supposed to be representing, not just about representation, but integral to what we do, and then use that in the external. But leadership is crucial, and I think a human rights approach can be really useful around leadership, because it's about that connection. So it's about the connection to all of us, and it's not about looking at a particular issue because it's a special issue, but it's about understanding kind of what does being a human being and intersectionality actually mean, what is connecting us all, and what are the barriers, and how do we actually address those. So I think it can be a really important internal kind of narrative as well as the external policy one.
Deborah, do you want a quick 30-second comeback to that in terms of, again, the practical implications for the National AIDS Trust within this context?
Yes, but I think what I would do is, in terms of the practical implications, really encourage people to have a look at our strategic plan, because that's where we've done, it sounds like a kind of glib answer, but we prepared for this, and that's where we've really kind of laid out our thinking in terms of the type of work that we're going to do over the 5 years to make this a reality.
Fair enough. Let's move on to, there's quite a kind of a bouncy, hopefully quite a spicy question from Shireen Cowley about how do we challenge stigma in the age of far-right social media, and how do we address the impact this is having on the mental health of HIV positive LGBTQ plus migrants and refugees. Nancy, if I can start with you. Obviously Stonewall has a huge experience of, let's face it, getting in the neck from the media. I'm a member of the media myself. I'm going to remain quiet at this point. But how does one combat, the impact of the far right or just social media in general within the context of mental health?
I don't know what you're talking about, Hugo. We're extremely popular and have many, many fans who express themselves in unusual ways. I guess I think a few things about this. One is that I think it's really important to do kind of two almost contradictory things. One is not engage, right? Because a lot of it is just shouting into the wind. And the other is be engaged enough to understand organised movements, because there are very clearly organised movements. In the case of some of the kind of anti-trans, anti-gender movement, that is an international movement made of lots of different and quite strange bedfellows, gender critical feminists, Christian right-wing organisations from America, etc., etc. So you have to engage enough to understand the pattern, and you have to engage enough to understand the stories that are being told and reproduced. But it's important to not engage as more than that. And I think that one of the kind of best pieces of advice, I shouldn't admit this is the case, but I can only see what people say to me on social media if I follow them. And this was one of the best pieces of advice I've ever received in a professional context, because it means I can't see all the people that are basically being abusive. And certainly, I mean, I've been blown away by the kind of level of kind of nuance and systematicness that kind of trans colleagues put in place to support each other and their cis colleagues around this. I get like way too much support, actually. I feel guilty about it. But so I think you've got to understand the movement part of it. You've got to understand what the fight looks like, but you have to try and protect yourself from the day-to-day individual comment rabbit hole. And I think there's also something important about understanding that people who spend all their time shouting on social media are not all people. So I think there's a serious bit of it that needs addressing, and I think there's a bit of it that's just horrible and abusive, and those that feel able to engage, I salute you, and those that don't want to engage, I salute you too. Do you do what you need for mental health? I think there is a very serious question about how we cut through that, and I don't think we are always as good at telling a story as we could be. So I think all of that stuff about what is the kind of strategic approach to communicating on any kind of rights-based issue, including these ones, that is resonant, that people understand, that they can pick up and run with. I think those are very sort of serious questions for us to address. Sorry, that was a bit incoherent, but I think those three things, I guess.
No, that's spot on. And Dennis, the part of the question was also about the experience of migrants and refugees. So back to your point about including them in the conversation, how does one do that without running the risk of having it blow up on social media and actually end up damaging the mental health of the people concerned?
I think that we've not been able to create platforms to highlight experiences of migrants through the trajectory of migration. So my thinking is that public attitudes are informed by ignorance. So for example, very few people know that many migrants get infected when they've arrived in Europe. The other issue is really around the benefits, the public health benefits of testing everyone and treating everyone, the economic arguments about this, and also the human rights approach. And I think that until we have forums where we can engage in discourse around the rights of people, human rights, viewing people as human beings and not as migrants, being able to educate the public around, public health issues, and especially those ones of concern, making people aware that migrants are not health tourists. We come to these countries when we are very healthy, and actually, unfortunately, the situations we find ourselves in exposes us to more risk and more poor health. So a lot of migrants are very productive, hardworking people. So I think that these kind of narratives need to change, and the media has a huge responsibility to play in this regard. And I think that social media companies have massive resources, and they have never managed to address issues around abuse and on social media. Their daily complaints. So I don't think that there's any solution to that at the moment, but public perceptions must change, and the media has to lead on trying to, change the narratives around migrants. So we have to move from the far right kind of hate and xenophobia to a more productive and tolerant society.
Quickly, time for, I think, one more question. Questions come in for Juno specifically, if I may, Juno. This is from an anonymous attendee. How do we honour trans people's experience and expertise in the work we're doing in the HIV sector? Particularly when you're talking about, at times, you're the only HIV positive trans woman that's kind of dragged onto these type of things. I mean, how do we ensure that it's part of the conversation?
Well, I think it fits into what everyone's been saying, which is that we need to reframe the narrative. I mean, and that goes into everything. It kind of fits into all of this stuff. I mean, if we reframe narrative of the abuse on social media, if we reframe that, and if we reframe them as, you know, although there are some groups that are really well organized, but they're very small, they're very few of them. And in that time, actually, one of the largest book deals in the country, Monroe Verbdorf, you know, achieved one of the largest book deals in the country. Paris Lees is now writing for Vogue. You know, I've had books, I mean, I wrote the lead feature last year in Bitch magazine in America on pleasure. It's the leading feminist magazine in America, and I wrote the lead feature on pleasure. I mean, there's this stuff that's happening, and I think that what we have to do is to just not, you know, when we see people as victims, we frame them in such a particular way that we never see them as being employable. And actually, if there's one takeaway from this, it's you know, we could change all of this really easily if we change up the makeup of us. If we weren't us sitting here having this conversation, you know, and if we really went that extra mile to really ensure that we are employing the people that need to drive this through, because essentially we're always driving it through from the outside. I mean, I've always said that to people over the last kind of 20 odd years. You know, I'm one kind of trans person. I'm just one kind of, you know, like my experience of HIV is like, it's, you know, it's like it's one kind of experience of HIV. My life is one kind of life. And although there are parallels with other people's lives, it's not the one thing. We're only going to get this right when there are more people talking, and talking from positions where they can make, as Dennis said, where they can make changes, structural changes. And you know, this could be resolved in a second. I mean, it really could be. And that whole kind of far right stuff is kind of like, we enable it in one way to have the oxygen, because we don't celebrate. We could have chosen to celebrate Monroe, Paris, any number of people, but still we focus on the victim. And you know, what I've tried to do especially over the last few years, is to say to people, please stop quoting statistics about suicide in trans people, because they don't lead anywhere. And if there's a young person, I've just done, my last book was where I interviewed some of the youngest trans people in the country. Some of them are 5 and 8, and you know, they're fabulous. They've got the answers, they've got it down to pat, they've kind of got it. And if we just listen to them and don't, you know, and they get, and some of them would say to me, I wish people would stop talking about suicide, because I'm really happy now that I can go to school as me. I'm really happy, genuinely happy. And one parent said to me, and this is really telling, I feel like my child doesn't need, which is why I called the book Gender Explorers rather than using the word trans. The parent said to me, I feel like my child doesn't need to know the word trans or transgender, but I feel like they might need to when they get to 10 or 11, because politically they might need to. You know, it's kind of like, I think I've kind of gone off the topic slightly, but I feel like we just really need to reframe the narrative, and part of the easy way to do it is just to change us. Well, and we can do that, and do that very easily, because there are no trans, you know, last year I think there were 900 articles written about trans people, but I haven't been asked to write a single piece by a single broadsheet for the last year and a half. Not a single piece have I been asked to write. They haven't reviewed my books. Gender Explorers is probably the most important book about trans kids to come out. They didn't really, I mean, they're more happy to talk to, I mean, they might ring me for a quote on J.K. Rowling, who's an expert on wizards, but not on me. But, you know, it's kind of like we need to reframe it. And I feel like the answers to that are very simple.
Well, just as a final word, if I can come to Sanchita, perhaps to kind of sum everything up, and also again, back to your point, Sanchita, about looking at this through a kind of a human rights approach, a human rights lens. Can we find a solution to some of the issues raised this afternoon through that approach, do you think? And again, in about a minute, if you would mind. Thank you.
Okay, well, yes is the short answer. The long answer is, but it takes some work. And I think it takes work, it takes investment, it takes time, and it takes commitment. And as I said before, it takes much more than just saying we are for human rights. It is about how we are working, who we're working with, how we're working with them, and kind of how we're working as an organisation, who we are, whoever that we is, and to think about it in that broad context of human rights. So I think absolutely it is. I have seen really huge transformations within organisations, even within actually voluntary sector organisations, where they're a very rights-based organisation in their policy work, but then actually the work that they were doing with the people who they were supporting huge barriers, and actually those people didn't know what their rights were. They didn't know actually how to engage properly with the organisation. All of the challenge that happened there was this gap, but yet on the outside, the organisation was very much about human rights. So I think we can do it, but it has to be more than a policy commitment. It has to be about, as organisations, as sectors, how are we actually taking that forward in a realistic way that we kind of put internally. And I would also say, probably as someone who's worked on human rights for about 20 years, which is possibly one of the most unpopular kind of media topics you can ever imagine, I think the thing I would kind of really urge people to do is think about what your story is and tell your story. The more you respond to the negative debate, the more oxygen you give that negative debate, and the more you reinforce that. Someone once told me, we used to do myth busting around human rights, and then kind of we would test where people were after it. And essentially, people remembered the negative thing, because by trying to undo that negative thinking, all we did was reinforce the very thing that they thought they knew in the first place. So be really clear about what your commitment is, what your story is, and why you're going to take rights forward.
Fantastic, and some good practical advice there too, on a note of, I think, cautious optimism on which to finish. But thank you for a hugely entertaining and really fascinating and insightful discussion this afternoon. So thank you to our panelists, Dennis, Juno, Nancy and Sanchita. And I'm going to hand you back to Deborah Gold just for a couple of finishing remarks. But in the meantime, thank you very much also to the attendees for joining us this afternoon. Thank you.
Thank you, Hugo.
Thank you so much. I actually think, well, I want to enormously thank all of the panelists for their time and incredible comments, but Jane actually has some kind of final remarks, so I think if we just hand over to her and she will make the kind of closing remarks for the event.
Well, thank you very much indeed, everybody. Drawing this webinar to a close, I'm sitting here. It's been incredibly powerful, really illuminating, instructive, and actually really enjoyable discussion. And as I've sat and listened, it's just shown us, I think, how much work there is still to do, and for all of us to do, and for all of us to do together. And the more we do it together, the more powerful it's likely to be. And I've been thinking all the way through about this human rights piece. And as a doctor, of course, people talk about health is a human right, but obviously from what we're hearing, it's quite clear to me that health cannot be achieved unless the much wider raft of human rights are achieved and honoured. And what happens at that intersectional crossroads that we've talked about of gender and race and sexuality and migration and citizenship is at the heart of health and well-being. And we have to get a greater interest and engagement and sorting some of these really big intersectional issues out. And I think it's really, for me, highlighting why it's so important that human rights is at the heart of NAT's strategic direction and our work over the next 5 years. And thank you to all our panelists who actually asked us as NAT to reflect on ourselves as well as on the work that we're doing. I pledge that we will take that forward and we will do that. Some really big thank yous from today. The wonderful panel of speakers, Deborah Gold, Dennis Oyanga, Juno Roche, Nancy Kelly and Sanchita Hasali have just brought huge expertise and real richness of experience to this debate. And I hope very much that we can continue to call on you for that expertise and partnership as we go forward. Hugo, thank you. You steered us and facilitated a very rich discussion. You kept us all to time with great kindness and firmness. And I think without your hand on the tiller, we would not have had such a powerful and rich discussion. Thank you very much. And turning to the strategic plan, so many people have given their time, their expertise, and helped us to develop the plan and gave us the right critique and feedback, which I hope is taking us in the right direction. Andrew Johnson worked with us to develop the plan. He was tireless. He gave more of his time than we had ever asked him to, and we are absolutely delighted to have been able to work with him, and the plan is the stronger for all the input he gave us. And Sherlock, who developed our new fresh look, please do go to our website, take a look. It's different. We've got some really important new messages there, so please go and have a look at our website. website. And absolutely thank you to all the National AIDS Trust staff, because webinars like this, strategic plans like this don't just happen. Everybody's worked so hard to get everything ready, particularly Annabelle, Unity, Joe and Kat, and of course at a time when we're not even together in the office in the way that we normally would be to make these things happen. So everybody's been working in even more challenging circumstances than usual. And to everybody who's joined us today, in a normal world, actually not even a normal world, a year ago, we would have been together in a room, we would have had a glass of wine together, we would have been able to continue this conversation. But thank you for joining us online. Please continue to be with us, stay connected to NAT, please stay connected to our work, and hopefully to the changes that we all want to see happen. NAT has a very long tradition of working in partnership, and there are many, many ways for everybody to get involved to support NAT and support NAT's work. The website has a donate button, because actually in this time of COVID, particularly, finances are tighter than usual. So please, if you can support us that way as well, that would be wonderful. So thank you, everybody. I think our strategic plan could not have had a better starting point. We have a long way to go, but thank you for everything that you've done to help us this afternoon. And thank you for a fabulous webinar. And a glass of wine and goodbye from me.